The Health Quality Forum is a new event on the quality calendar. The conference in Baltimore on April 7th and 8th offers people who care about quality a new way to learn, connect, and succeed in a dynamic healthcare environment. I'm Andy Reynolds. Today on Quality Matters, 3 NCQA leaders share how they view the contemporary quality landscape and how that shapes what people can expect at the Health Quality Forum.
Hey, Andy. I'm Kristine Toppe. I am Vice President for State Affairs at NCQA.
Hi, I'm Rachel Harrington, AVP for Health Equity Sciences at NCQA.
Hello, my name is Stacy Grundy, and I'm Director of Quality Sciences Innovation.
Kristine, Rachel, Stacy, the Health Quality Forum in Baltimore on April 7th and 8th comprises 4 tracks: structural solutions for state policy topics, data and interoperability, population and rural health, and virtual care. Plus, there are sessions about NCQA accreditation programs. We'll turn to all of that content that you're creating in a minute. But first, fill me in on how you go about organizing a conference that'll keep quality professionals current on what they need to know. What's your priority, or what do you keep top of mind? Stacy?
We really focus on translation. How do we translate the evidence, the theory, into practice? We know that has been missing. You get too much theory, people don't understand how it applies on the ground. And we've taken the theory, these are evidence-based practices. We've seen them work in different states, and now we are showing how people can apply them. And so really this forum is taking the evidence and putting it into action.
Rachel, you spend a lot of time studying health disparities. How does doing that at NCQA show up or affect a public event like the one you're organizing?
One of the things that always stands out to me is NCQA, because of the interactions that we have, states, plans, systems, primary care across the country, we get to learn about cool things that are happening. This is the opportunity to elevate what's been shown to work. This is the chance to get excited about that and see the proof of concept that might make your life easier. That could come from places you expect. It could come from places you might not expect.
Kristine, you recently logged your 27th year at NCQA, and you've learned a thing or two in becoming Vice President for State Affairs at NCQA. How does what you've learned benefit people at other organizations when you put together an event like the Health Quality Forum?
Yeah, a lot of conferences talk about problems and how did you address that? What are success stories? We were mindful of that in planning this event, wanting to ensure people had something tangible, as well as being able to network and make connections, whether state to state, plan to state, plan to plan, whatever those connections might be. One of the things that makes our events interesting is we get public sector folks, we get public sector participation beyond just the speakers. So it's nice to have that in-person connection you can't get in other places. Bringing that policy perspective and shine a light on the things states are trying to showcase best practices and lead by example.
Let's get into some of the content of what the forum will focus on. Kristine, I understand that in some ways the Baltimore event builds on the NCQA forum you helped organize in your home city of Los Angeles a year ago. But in some ways, the Baltimore event is different. How so?
Yeah, the 2024 Health Forum focused on California. Last year's forum was the first time California's public purchasers and regulators had all been on one stage together, which was exciting for us and for them. We made this more of a regional event this year. We just have a broader set of states. We are featuring Maryland, giving them the policy floor, featuring the Medicaid program, the state exchange program, as well as their HIE and their incoming Secretary of Health, Mina Seshmani. We're looking forward to hearing from Maryland and what they've been able to do to address disparities. We were excited. They wanted to be part of the event, given that it's in Baltimore, and be able to kind of have some of the local stakeholders participate as well.
And you say other states in the region are sending officials who will speak?
Yeah, we're excited to feature Maryland, but also showcase some neighboring states and their good work. North Carolina has exemplified leaning in to look at the full set of use cases for data. We're excited to have representatives from North Carolina Medicaid, as well as the state HIE. We have Pennsylvania. We may have other states that we can make a surprise.
What's different about how North Carolina uses data, and what will that mean for the Health Quality Forum?
Much of what we're focused on historically at NCQA is HEDIS plan level reporting. They're familiar with that, but they're also interested in provider level reporting and how can they use their state HIE to get at kind of multiple levels of reporting, and what does that entail, the way measures are built. There's a technical complexity that has downstream complications for providers and what those measures look like and how they pull in different data sources. So we're excited to have representatives from North Carolina Medicaid as well as the state HIE talking about their partnership to improve ways they're collecting and using data to get to multiple use cases. HEDIS plan level reporting is valuable for policymakers, but the most important thing is, are patients getting the care they need? Do the doctors have the information they need as well? So we're excited to have them come talk to others that are interested in implementing a similar strategy in their state.
Rachel, I know you spend a lot of time thinking about data. What are some best practices that have caught your eye, and how do those factor into what I might learn at the forum?
We have some cool examples coming from the state of Pennsylvania. We have the panel who's coming to talk about systems they've set up to let data on patient-level unmet social needs flow between partners in the healthcare system. They're creating integrated social needs data networks between their Medicaid agent plans, their Medicaid agencies, their HIE, their health information organization, and a social needs referral environment where different partners have access to data and equal opportunity to act on data. I'm really excited for that session from Pennsylvania.
Okay, the name of the track is Data and Interoperability, and you've mentioned data. Tell me more about the interoperability piece, please.
We're letting the states shine here, be it the plans, systems, community partners, docs on the ground, the state Medicaid agency trying to understand their population and plan services. Everybody's plugging into the same health information organizations, trying to get data to facilitate action. And that doesn't happen if everybody's on different standards or sitting on their own little data hoard and not sharing it. So that's where interoperability comes into shine. The state of Maryland session, HIEs, the health information exchanges, are all about interoperability. It's core to quality, and it's core to addressing disparities and closing gaps in care, because if you have care teams at different places who don't know, hey, somebody was just in the hospital over here, somebody doesn't have transportation to their appointments, somebody just had a COPD exacerbation and really needs some help out here, then someone's going to get left behind. So that idea of collecting data in a standardized way, it's highlighted multiple sessions for a reason.
Kristine, Stacy, anything to add about how you think about interoperability and how that will manifest in what you've planned at the Health Quality Forum?
We have several HIEs participating in this event, and they're all a little different. So it's important to hear for audience members that are interested in that, don't have that infrastructure in their own state, to bring those perspectives back and be able to say, okay, I think this model is close to what we want to do, or we can take these learnings. Our work can amplify and shine a light on those that we think are doing it well and have really productive use cases to get it started. You have to start somewhere. So that's one of the things we're really excited about with respect to data and interoperability.
And I'll just add why that is important. We hear from different states about the fragmented system they are working within. That is why it's important to see the systems or see the providers who are doing it well. You can learn, you can take those lessons back and keep in touch with people so we can all work together as we improve healthcare access.
We've talked about interoperability and the great examples there, but I don't want to lose track of the data piece, because data for the sake of data doesn't help anybody. If it just sits there and you pat yourself on the back, I've got this sitting in my database, that doesn't help. What you do with it matters. And we have a couple of sessions digging into innovating to address health disparities, talking about analytics to understand populations and how to address interventions. Also sessions focused on creating equitable systems of care for populations with disabilities, understanding where unmet needs are, how to make things accessible, make things usable. And data is a part of that. It's understanding who, what, when, where, and how to take what you're sitting on in your organization and understand it so you can improve care.
Kristine, I want to get to other topics, but bottom line this for me, please. What's different about the NCQA way of thinking about data and interoperability that people will get at the Health Quality Forum?
Concrete next steps when it comes to looking at your clinical data and what opportunities you have to modernize it. The HIEs present from various states, that's the message they will bring. I don't know that is something you're going to hear in other places because we're looking at the measure reporting use case is one, but we're really looking at the full spectrum of use cases that states and the systems involved in data exchange address. We are unique in that perspective.
Another focus or another track at the forum is population health and rural health. Stacy, I understand that's important to you.
You have about 60 million Americans who live in rural communities. Also, growing up in a rural community, which was medically underserved, I know the challenges of getting to the doctor, getting quality care, getting access to specialty care. I'm excited that we're able to bring sessions on rural health. Even within rural, we're focusing on how communities are using data to leverage virtual care because we realize organizations don't have endless money. So we're really excited because these are organizations using the data to be precise in serving populations that are in most in need. Those include rural populations, veterans, individuals with disabilities, and because we know that they live all over the country. To serve them, we have to know where they are.
What's an example I can learn more about at the forum?
A real innovative session focuses on using digital tools in rural health settings. We have a group out of Arkansas doing innovative things with high-risk moms and pregnant women, where they're using digital tools to do genetic testing. They were able to reach women that they had never reached before. The reason that is important is in rural areas, you have individuals driving sometimes 100 miles to get to a specialty physician. You have transportation, you have things about getting off from jobs or just not even have the resources to get there. That reduces quality, reduces access, which is a huge barrier and will impact the mother and the baby. So having programs that use virtual care is able to save lives. I'm excited that we could bring this to the stage at the Health Quality Forum because these are stories we want to share.
And Stacy, that was just one of the rural care focus sessions on the agenda,
yes.
Right? That's a whole theme that's been pulled through this.
Yes, there's a panel that includes former state leaders where they worked with different agencies to develop funding streams so safety net hospitals could purchase virtual tools to create an infrastructure and continue that innovation. Sometimes rural healthcare organizations feel isolated. We're giving them a platform where they can network with larger systems as well as learn from each other and connect.
Stacy, when I hear about rural areas and telehealth, I think about broadband access. What will we hear about that in Baltimore?
We know broadband access is an issue. So some states, South Carolina, their telehealth alliance, will talk about how they overcame challenges around broadband access. Panelists are talking about what tools worked and which ones didn't. We'll hear about different platforms around how did they work with policymakers and community-based organizations to tackle those challenges.
Rachel, can you give me some more context? Why is telehealth important to discuss at this event now?
We're in a really interesting policy environment. Some telehealth policies put in place to facilitate access during the pandemic are set to expire. But in the last couple of years, telehealth has expanded and met many patient populations. On day one of the forum, we have Ann Johnson from the American Telemedicine Association. Eric Schneider, our executive vice president, one of our leading doctors in the organization, is going to sit with Ann Johnson and walk through what is telehealth in 2025, where is it going, and how can it meet patients where they are. They'll be joined by a speaker from the VA who's been doing innovative work in Boston to meet patients where they are with virtual solutions. Having that conversation about what telehealth looks like in 2025 and beyond, I think is going to be a great dialogue.
So, Rachel, I'm getting that there's a lot of interdisciplinary overlap between these topics and tracks. I know you run into that in your work as a health sciences researcher. How does that cross-pollination play out when you're setting up something like the Health Quality Forum?
It's kind of funny. We talk about these things as distinct topics, right? Veterans, populations with disabilities, individuals living in rural areas, data, virtual care. It's nice to do that for track purposes. It lets you filter your sessions and kind of understand. But these are all things that interact with each other One of the cool things about the forum is letting all of these topics be in conversation with each other. How does virtual care interact with care for veterans? That's reflected in our panelists in those sessions. How, when you're trying to serve and understand populations with disabilities and make care accessible, what are the data you're sitting on to help with that? So don't let the filters fool you. There's a lot of cross-pollination in the discussion that's happening here.
Under that larger topic of population health, is there anything else you're paying attention to that you'd like to call out?
In the population health track, we have a session coming out of work that NCQA has been doing around birth equity accountability. We've had recommendations for rethinking what holistic whole person quality measurement looks like for people who are giving birth. And this panel is really a representation of all that team has done to transform perinatal care. We'll have Susan Perez from the Praxis Project, and then speakers from Baltimore City Council, speakers from University of Maryland Medical System, certified nurse midwife from the March of Dimes. So really thinking, if we want women and babies to be healthy in this country, who are the people who have their hands in that work?
So to recap, 4 major tracks that blend together or cross-pollinate: structural solutions for state policy topics, data and interoperability, population and rural health, and virtual care. In addition to all that, you're planning some hands-on how-to sessions about some NCQA accreditation programs. What are those and how will they work?
There are 3. There's 2 for Health Equity Accreditation 101, Health Equity Accreditation 201. Participants hear from internal experts, the people who run these programs at NCQA, about what's in our standards, parsing the technical requirements, what it means to be surveyed on these standards, and take that back to their organization. We're also doing this 201 session. You've already begun your health equity accreditation journey. Maybe you've already gotten the accreditation, you're in the midst of surveys, but you're about to come up for your survey renewal, or maybe your organization is looking to take it to the next level. So let's talk about some of the data metrics that you could be using. Let's talk about partnerships, which is a focus of our Health Equity Accreditation Plus.
Okay, so that's 2 workshops about health equity accreditation, the basic and the more advanced. What's the 3rd session about an accreditation program?
New this year is the virtual care workshop for NCQA's new virtual care program, hearing about the standards and the expectations from the experts and having those opportunities to ask questions and get familiar so that you're empowered to succeed in these programs.
Kristine, do you have some thoughts about those education workshops?
Yeah, the in-person education session that's offered on day 2 will be useful because they'll learn from the folks that are coming to present at the forum and then from the other folks in the room with them. Some of the best learning is from other people's questions.
That's a good point, Kristine, and I know you have to go, so thank you for that. Stacy and Rachel, let's give you the last word. What stands out for you personally as the thing you most want to see or the thing you're most curious about at the forum? Stacy?
I'm really excited. We're able to bring organizations that maybe haven't been speakers or been spotlighted at our panels or forums before, just bring in people who have been doing great work, and now they're able to showcase that. That's what I'm excited about.
Rachel, what about you?
I'm excited for our panelists to be excited for the conversations that happen when we put people together and get them talking, because you can plan all you want, but when you get people in conversation and you hear the ideas as they connect the dots between each other's work, that's what's always most exciting for me. The ecosystems, data interoperability, who's generating the data, who's sharing the data, who's using the data, who's represented in the data. Bringing those perspectives together to share what's working, what's not working, representing some exemplary practices across the country, focusing on the teams, the systems, the practices that you might not hear from as much to address the needs of rural populations, veterans, mothers and babies, and populations with disabilities. That's what stands out to me, because if we try and solve this in isolation, or we try and keep it one perspective on one side and another perspective on the other side, we're not going to get to a solution.
I think that's a good place to end it. The NCQA Health Quality Forum is April 7th and 8th in Baltimore. Register at ncqaforum.org.
Thank you for listening to Quality Matters. You can always learn more at ncqa.org, and be sure to subscribe to Quality Matters wherever you get your podcasts. We'll see you next time.